Are you worried about passing your big medical test, but you really want to succeed today? These questions will help you get your certification on the first try. Please leave your helpful suggestions in the comment section, so we can improve our next video. Section 1, Welcome to our class, where we will learn about saving lives in a medical emergency situation. You and I will work together, and we will make sure you understand every single concept. When someone has a heart problem, you need to act fast, and you must know the steps. We use a step-by-step plan, which helps us remember exactly what we need to do. First, you always start with the basic life support survey, which is the foundation of our care. Before you touch the patient, you must check the area, because your safety is always the priority. If the room is safe, you can walk up to the person and check if they respond. Tap their shoulder hard, shout out loud, and ask if they're okay right now. If they do not answer you, you must call for help and tell someone to get tools. You need to get the emergency machine, which gives a shock to the heart if it stops. Next, you must look at their chest and check if they are breathing like a normal person. At the exact same time, you should feel their neck and try to find a strong pulse. You only have 10 seconds to do this, because time is a big deal in these moments. If they are not breathing, and they have no pulse, you must start chest compressions right away. Push hard and push fast on the middle of the chest, and let the chest come back. You need to push down at least 2 inches, and do it 100 times a minute. After you push 30 times, you need to give them 2 breaths, using a protective mask device. Make sure you watch the chest rise, because that tells you the air went inside the lungs. When the shock machine arrives, turn it on immediately, and listen to what the voice tells you. Put the sticky pads on their bare chest, and make sure no one is touching the patient. If the machine tells you to shock, you press the button, and then start pushing the chest. Now that we understand the basic rules, we need to test your knowledge with some practice questions. These questions will help you remember the steps, so you can pass your big test with ease. Take your time to read the question, and think about the best answer before you move on. We will go through 19 questions today, and I will explain the correct answer for every single one. Train, test, we need to fix, repeat, until you feel confident in your amazing medical rescue skills. 1. What is the very first step you must take when you arrive at a medical emergency scene? You must carefully look around the room and make sure the scene is safe for you. You cannot help a sick patient if you get hurt by a hidden danger in the room. 2. How many chest compressions should you perform in 1 single minute during an emergency rescue attempt? You need to push on the chest between 100 and 120 times a minute. This fast speed pushes the blood around the body and keeps the brain alive during the emergency. 3. How deep should you push down on an adult chest when you are doing your compressions? You must push down at least 2 inches, but do not push more than 2.4 inches. Pushing deep enough squeezes the heart muscle, forcing the trapped blood out to the rest of body. 4. What should you do after you push on the chest, before you push down on it again? You must let the chest come all the way back up to its normal, resting top position. Letting the chest rise back up allows the empty heart chambers to fill up with fresh blood. 5. How many breaths do you give to an adult patient after you do your 30 chest compressions? You must give the patient 2 normal breaths and watch their chest rise up with the air. 2 breaths give them enough oxygen to survive, without stopping the important chest pushes for too long. 6. If the patient has a plastic breathing tube in their throat, how often do you give breaths? You give them 1 single breath every 6 seconds, while another person continues pushing on the chest. The tube protects their airway perfectly, so you never need to stop the compressions for the breaths. 7. What is the main goal of the primary basic life support survey during a scary cardiac emergency? The main goal is to start high-quality compressions early and use the shock machine very fast. Doing these simple basic steps quickly gives the sick patient the absolute best chance to wake up. 8. What is the first drug you give to a patient when their heart completely stops beating entirely? You give them 1 milligram of epinephrine, and you push it straight into their arm blood vein. Epinephrine makes the blood vessels squeeze tightly, which sends more blood back into the heart and brain. 9. How often can you give a dose of epinephrine while you are trying to save their life? You can give this special drug every 3 to 5 minutes during the entire cardiac arrest event. The drug washes out of their system quickly, so you must keep giving it to help them. 10. Which 2 dangerous heart rhythms require you to use the electrical machine to give a big shock? You must shock ventricular fibrillation, and you must also shock pulseless ventricular tachycardia to save their life. A shock stops the shaking heart muscle and allows the normal pacemaker to start a good beat. 11. What must you do immediately after you deliver an electrical shock to the patient on the floor? You must start pushing on the chest right away, without stopping to look at the monitor screen. The heart needs time to recover after a shock, and compressions provide the blood flow it needs. 12. Which dangerous heart rhythm looks like a completely flat line on the medical monitor display screen today? The flat line rhythm is called asystole, and it means the heart has no electrical activity happening. You cannot shock a flat line rhythm, so you must rely on good compressions and drug injections. 13. If the patient has a very slow heart rate and feels dizzy, what is the first treatment? You should give them a drug called atropine to help speed up their dangerously slow heart rate. Atropine blocks certain nerve signals in the body, which allows the heart to beat faster and stronger. 14. What should you do if the atropine medicine does not fix the dizzy patient with slow heart? You can use the shock machine to pace their heart, or give them an epinephrine drug drip. Pacing acts like an external battery for them, sending tiny shocks to force a normal heart speed. 15. When a patient has a fast heart rate over 150, what is your first step? You must check if the patient is stable by looking at their blood pressure and mental state. Knowing if they are stable or unstable tells you if you need to use drugs or electricity. 16. If a fast heart rate patient is confused and has low blood pressure, what do? You must use the medical machine to deliver a synchronized shock to reset their fast heart rhythm. Unstable patients do not have time to wait for drugs, so electricity is the fastest rescue method. 17. What special drug do you use for a stable patient with a regular but fast heart rate? You should push the adenosine drug very fast, followed by a quick flush of salt water fluid. Adenosine slows down the electrical signals in the heart, helping it return to a normal resting speed. 18. What is the target oxygen level you want to maintain after the patient finally gets a pulse? You want to keep their blood oxygen level between 92 and 98% right now. Giving him too much oxygen can actually cause harm, so we keep it in a safe range. 19. Why do we lower the body temperature of a patient who does not wake up after arrest? We cool their body down to protect their brain and prevent further damage from the lost oxygen. Cooling down the brain cells slows their metabolism, giving them a much better chance to heal completely. Please remember to check the description box below to get the full course and learn much more. Section 2. Welcome back to our class, where we continue to learn about saving lives today. In this second part, we will talk about heart attacks and bad brain strokes. You must act very fast, because time is muscle and time is brain tissue. Let us start with a heart attack, which doctors call acute coronary syndrome today. A heart attack happens when a blood clot blocks a pipe in the heart. The heart muscle dies quickly if it does not get enough fresh blood flow. Patients often feel heavy pain right in the middle of their chest area now. The pain can move up, straight into their left arm or their jawbone. When someone has chest pain, you must get an EKG picture right away today. You have only 10 minutes to get this special picture of their heart waves. This EKG picture tells us if the patient has a massive heart attack happening. If the picture shows a big heart attack, we call it a STEMI today. The best treatment for a STEMI is a quick surgery to open the pipe. We want to open the blocked pipe within 90 minutes of them arriving here. If a hospital cannot do surgery, they give drugs to melt the blood clot. While you wait for the doctor, you can give the patient some baby aspirin. The patient should chew the aspirin, so it works faster in their sick body. Aspirin stops the blood flow from getting bigger, which saves a lot of muscle. You can also give them a drug called nitroglycerin under their tongue right now. Nitroglycerin opens the blood pipes, but you must check their blood pressure first today. If their blood pressure is too low, you cannot give them the nitroglycerin drug. Next, we need to talk about a stroke, which is an attack in the brain. A stroke happens when a blood clot gets stuck inside the patient's soft brain. The brain cells start to die when they lose their fresh blood oxygen supply. You can spot a stroke fast if you remember to check their face carefully. Ask the person to smile wide and see if one side of their face drops. Ask them to raise both arms and watch if one arm slowly falls down. Finally, ask them to say a simple sentence and listen for slurred speech sounds. If you see any of these signs, you must call for emergency help immediately. At the hospital, the doctors will do a scan of the patient's sick head. They need to do this head scan within 25 minutes of their arrival. The scan shows if the stroke is from a clot or a bleeding pipe. If it is a blood clot, the doctor can give them clot-busting medicine. This powerful medicine must be given within 3 hours of the stroke starting today. You must keep track of the exact time when the patient was last normal. If you do not know the time, the doctor cannot give the special medicine. You also need to check their sugar level, because low sugar looks like a stroke. High blood pressure is also a big problem when a patient has a bad stroke. Doctors will try to fix the blood pressure before they give the clot medicine. Teamwork is still a big deal when treating a heart attack or a stroke. The team must talk clearly and move the patient fast to the right room. Every minute you save today helps the patient live a much better life tomorrow. We must work together to give the sick patient the best medical care possible. Now let us do some practice questions, so you can learn these new rules. Train, test, we need to fix, repeat, until you are a great medical provider. 1. What is the most common sign that someone is having a bad heart attack? They will feel a very heavy and crushing pain in the middle of their chest. The heart muscle is dying from no blood, which causes a terrible amount of pain. 2. How fast should you get an EKG picture for a patient with chest pain? You must get the EKG picture within 10 short minutes of the patient arriving today. The EKG tells you if the heart pipe is completely blocked, which requires fast action. 3. What does a STEMI mean when you look at the patient's printed EKG picture? It means there is a big heart attack caused by a completely blocked blood pipe. A STEMI is the worst kind of heart attack, and it needs surgery right away. 4. What is the time goal for opening a blocked heart pipe with a balloon? The doctor should open the blocked pipe within 90 minutes of the patient arriving here. Fast surgery saves the dying heart muscle and gives the patient a good recovery chance. 5. What should you give a patient to chew when they have suspected chest pain? You should give them between 160 to 320 milligrams aspirin. Aspirin helps to thin the sick blood and stops the bad clot from growing bigger. 6. Why must a patient chew the aspirin instead of just swallowing it with water? Chewing the baby aspirin pills makes the drug enter their blood system much faster today. We want the drug to work right away to save as much heart muscle possible. 7. What does the drug called nitroglycerin do for a patient with severe chest pain? Nitroglycerin relaxes the blood pipes in the body and opens them up much wider today. Wider pipes let more fresh blood flow, which reduces the chest pain for the patient. 8. When should you completely avoid giving the nitroglycerin drug to a sick chest patient? You must not give it if their blood pressure is lower than 90 top number. The drug lowers blood pressure even more, which can make the sick patient pass out. 9. What is a common simple test to quickly check a patient for a brain stroke? Ask them to smile wide, raise their arms, and say a simple sentence out loud. These 3 simple steps will show if their brain is having trouble controlling their body. 10. What happens to a person's face if they are having a severe brain stroke? One side of the beautiful face will start to droop or hang down very low. The brain damage stops the face muscles from working, which causes the visible drooping sign. 11. How fast should a hospital get a head scan for a suspected stroke patient? The patient must get a complete head scan within 25 minutes of arriving. Here, the scan tells the doctors immediately if there is bleeding in the soft brain tissue. 12. Why is a head scan so important before treating a suspected brain stroke patient? It shows if the stroke is from a clot or a dangerous bleeding brain pipe. You cannot give clot-melting drugs if the patient is already bleeding inside their head. 13. What is the time limit for giving clot-busting drugs to a stroke patient? You can only give the powerful medicine within 3 hours of the stroke symptoms starting. Giving the drug too late is dangerous because it can cause bleeding in the brain. 14. What must you ask the family when a patient arrives with bad stroke signs? You must ask them the exact time when the patient was last seen completely normal. The medical team needs the exact starting time to safely give the clot-melting drugs. 15. What simple body condition can look exactly like a bad stroke in a patient? A very low blood sugar level can make a person look like they had stroke. You must check their sugar level fast, because fixing low sugar is easy and quick. 16. Why do we worry about high blood pressure when treating a brain stroke patient? High blood pressure can cause more damage or make the brain start bleeding even worse. The doctors will give special medicine to bring the blood pressure down to safer levels. 17. What is the main medical goal when caring for a brain stroke patient today? The main goal is to save the brain cells by restoring the fresh blood flow. Brain cells die very quickly without air, so the medical team must act extremely fast. 18. What should you do if a stroke patient cannot breathe well on their own? You must protect their airway with a tube and give them some fresh oxygen air. Good breathing keeps the oxygen levels high, which helps the injured brain survive the attack. 19. How does good teamwork help when a patient has a severe heart attack today? Good teamwork speeds up the medical care, which saves more heart muscle from dying completely. When everyone knows their exact job, the patient gets to the surgery room much faster. Please remember to check the description box below to get the full course and learn much more. Section 3, welcome back to our training, where we focus on saving lives together today. In this third section, we will talk about helping people breathe properly. Sometimes a sick patient has a pulse, but they cannot breathe on their own. We call this bad medical emergency, a severe respiratory arrest condition today. When a person stops breathing, their sick heart will also stop very soon. You must act very fast and give them air with a rescue mask. You will squeeze the bag gently and give them one breath every 6 seconds. Make sure you squeeze the bag gently so you do not hurt their weak lungs. We must watch their chest to see it rise slightly with each single breath. If you give too much air, the extra air goes into their stomach area. Air in the stomach makes them vomit, which blocks their breathing tube entirely. This is a very bad problem, because vomit in lungs cause severe infections. To keep the throat open nicely, we can use a basic plastic airway tool. One common tool goes in the mouth, and it is called an oral airway. You only use the oral airway if the patient is fully unconscious today. If they are awake right now, the oral tube will make them gag and vomit. Another useful tool goes in the nose, and we call it a nasal airway. You can use a soft nasal tube, even if the patient is slightly awake. We use special medical jelly on the nasal tube, so it slides in very easily. Do not use the soft nasal tube if they have a broken face bone. Now let us move to the questions, so you can practice your new knowledge. Take your time, Toriad, carefully, and try to find the best possible answer. We will cover 19 practice questions to help you fully understand this important medical section. Train, test, we need to fix, repeat, until you are a perfect medical rescuer. 1. What is it called when a patient has a pulse, but cannot breathe on their own? We call this condition respiratory arrest, because their lungs have completely stopped working today. Even though their heart is still beating, they need your immediate help to breathe air. 2. How often should you squeeze the breathing bag for an adult in respiratory arrest? You must give them one single breath every 6 seconds to keep them alive. This steady breathing rate provides enough oxygen, without putting too much dangerous pressure in their chest. 3. What should you do if you notice the patient's stomach getting big during rescue breaths? You must squeeze the airbag more gently and make sure their airway is open. Pushing air too fast forces it into the stomach, which can make the patient vomit quickly. 4. When is it perfectly safe to use an oral plastic airway tube in a patient? You can only use the oral airway tube if the patient is completely unconscious today. If they are slightly awake, the plastic tube will trigger their gag reflex and cause vomiting. 5. How do you measure an oral airway tube to get the right size for the patient? You measure it from the corner of their mouth, straight to the bottom of the eye rear lobe. Using the correct size is extremely important, because a bad size can block their throat entirely. 6. When should you strictly avoid using a soft nasal airway tube to help a patient breathe? You must not use the nasal tube if the patient has a severely broken face bone. A broken face means the soft plastic tube could accidentally slide directly into their injured brain. 7. What is the best medical device to confirm that a breathing tube is in the windpipe? The waveform capnography machine is the absolute best tool to check the breathing tube placement. It measures the carbon dioxide gas coming out, which proves the tube is inside the lungs. 8. What does a perfectly flat line on the capnography screen mean after placing a tube? A completely flat line means the plastic tube is wrongly placed inside the patient's stomach. The stomach does not produce any carbon dioxide gas, so the screen wave shows nothing at all. 9. How does the capnography wave help us when we are doing our chest compressions? The height of the breathing wave tells us if our chest pushes a moving blood well. If you push hard and fast, the carbon dioxide wave will stay high on the screen. 10. What sudden change on the capnography screen tells you the patient's heart has restarted? You will see a very sudden and big jump in the carbon dioxide wave number today. The working heart pumps a lot of trapped blood, bringing more carbon dioxide to the lungs. 11. What should you do first if a conscious adult is suddenly choking and cannot speak? You must stand behind them quickly and perform strong abdominal thrusts to clear their blocked throat. Strong thrusts push air out of their lungs, which forces the stuck food to fly out. 12. If a choking patient becomes completely unconscious, what is your very next important action? You must gently lower them to the floor and start your chest compressions right away today. Chest compressions act like very strong stomach thrusts, which can dislodge the trapped food item quickly. 13. Should you ever do a blind finger sweep to remove food from a choking patient? You must never do a blind finger sweep because it is extremely dangerous for the patient. Pushing your fingers blindly in their mouth can easily push the trapped food much deeper down. 14. What does the team leader do during a very busy medical rescue emergency situation? The leader assigns specific jobs to everyone and watches the entire team do their work safely. The leader keeps their hands completely off the patient so they can see the whole picture clearly. 15. What is closed-loop communication, and why is it so important for the rescue team? It means repeating back every single order to make sure you heard the leader perfectly well. Repeating orders stops bad mistakes from happening, like giving the wrong drug or the wrong dose. 16. What should you do if the team leader tells you to give a deadly drug dose? You must use constructive intervention and respectfully ask the team leader to check the drug dose. Anyone can make a simple mistake during stress, so you must speak up to protect the patient. 17. Why is it important for every team member to know their specific limits during an emergency? Knowing your limits stops you from doing a task that you aren't fully trained to do. If you cannot do a job safely, you must ask the team leader for some extra help. 18. What is the main purpose of a team meeting after the medical emergency is fully over? The meeting helps the team talk about their mistakes and find ways to improve their skills. Reviewing the event makes everyone much smarter and creates a stronger team for the next rescue. 19. How often should you switch the person doing chest compressions to keep the pushers strong? You must switch the person pushing the chest every 2 minutes during the long rescue event. People get tired very quickly when doing compressions, and weak pushers will not save the sick patient. Please remember to check the description box below to get the full course and learn much more. Section 4, welcome back to our class, where we are learning how to save lives together. In this fourth section, we will talk about what happens after the heart restarts. Getting the pulse back is amazing, but our hard medical work is not finished yet. We must protect their fragile brain and keep their sick body very stable today. When the heart starts beating again, we call it a return of spontaneous circulation. First, we must make sure their blood pressure is high enough to feed their brain. If their top blood pressure number is very low, we give them fluid through their vein. We can also use special drugs to help their weak heart squeeze much harder today. Next, we need to check how well they are breathing with our special oxygen monitors. We want their blood oxygen level to stay perfectly between 92 and 98%. Too much pure oxygen is bad, because it can hurt their newly recovered brain cells. We also check their carbon dioxide wave to make sure the tube is still placed right. If the patient does not wake up, we must think about their body temperature quickly. A warm body needs more oxygen, which is very hard for a sick brain to get. Doctors use targeted temperature management to cool the sick patient down for 24 hours. Cooling the body down safely gives the damaged brain a much better chance to heal completely. Now we need to review these steps so you can remember them for your big test. Take a deep breath right now and let us work on these practice questions together. We will go through 19 questions today to make you a much smarter medical rescuer. Train, test, we need to fix, repeat, until you feel perfectly ready for the exam. 1. What is our very first medical goal after the patient's heart starts beating again today? We must check their blood pressure quickly and fix it if it is very low. A low blood pressure cannot push enough fresh blood up into their newly healing brain. 2. What kind of fluid do we give to a patient with very low blood pressure? We give them normal salt water fluid through a plastic tube in their arm vein. The salt water fills up their empty blood pipes, which raises their blood pressure safely. 3. What drug can we use to help raise a very low blood pressure number today? We can give them a special drug called epinephrine through a slow drip bag today. This drug makes the blood vessels squeeze tightly, which forces the blood pressure to rise. 4. Why do we avoid giving too much pure oxygen after the heart finally restarts beating? Too much oxygen creates bad chemicals in the blood, which can harm their sick brain. We keep the oxygen level perfectly balanced to give the brain exactly what it needs. 5. What oxygen percentage range is safe for a patient after a sudden cardiac arrest event? We want to keep their oxygen levels between 92 and 98% exactly. This specific middle range gives them enough air without causing any extra dangerous cell damage. 6. Why do we cool down the body of a patient who does not wake up? Cooling their body down slows the brain metabolism, which protects the brain from further damage. A cooler brain needs much less oxygen to survive, which helps it heal much faster. 7. How long do doctors normally cool the patient's body during targeted temperature management care today? Doctors keep the body very cool for at least 24 straight hours right now. This long resting period allows the swollen brain tissue to calm down and heal properly. 8. What special heart test must you get immediately after the patient's heart restarts beating again? You must get a complete 12-lead EKG picture to check for a heart attack. If the EKG shows a blocked pipe, the patient needs fast surgery to fix it. 9. What do doctors do if the post-arrest EKG shows a severe STEMI heart attack? The doctors take the patient to surgery to open the blocked heart pipe right away. Opening the pipe restores the heavy blood flow, which saves the damaged heart muscle tissue. 10. Why do we check the capnography wave closely when moving the patient to another room? The wave proves the plastic breathing tube is still safely inside the patient's lung pipe. Moving a patient can accidentally pull the tube out, which would stop their air supply. 11. What should you do if a waking patient tries to pull out the breathing tube? You must speak to them very calmly and hold their hands gently to stop them. They are very confused and scared, so explaining what happened will help calm them down. 12. Why is it so important to find the hidden cause of their sudden cardiac arrest? If we do not fix the root problem, their sick heart will just stop again. Finding hidden problems like low blood sugar helps us give them the perfect cure today. 13. What is a common hidden problem that can make a healthy person's heart stop completely? A large blood clot inside their soft lungs can block blood flow and cause arrest. We can use special clot melting drugs to destroy the blockage and save their life. 14. How do you check for low blood sugar during the post-cardiac arrest care phase? You prick their finger for a small drop and check it with a medical meter. If the sugar number is very low, we give them sweet medicine through their vein. 15. Where does the patient go after they are completely stabilized in the emergency room today? The stable patient is safely moved straight to the busy intensive care unit upstairs today. The special nurses upstairs will watch them continuously to ensure they keep recovering very well. 16. What should the medical team do for the scared family waiting in the next room? The team doctor must speak with them honestly and explain the patient's current medical condition. Keeping the family fully informed reduces their high stress and builds good trust with them. 17. If the patient has a seizure after waking up, what must the medical team do? The team must give them anti-seizure medicine fast, to protect their healing brain cells. Seizures burn up a lot of oxygen, which the recovering brain simply cannot afford today. 18. What routine blood test helps doctors know if the patient's kidneys are working perfectly well? Doctors run a basic metabolic blood panel to check the heavy work of the kidneys. Good working kidneys filter out bad toxins, which keeps the whole body clean and safe. 19. How does good teamwork continue to help during the post-cardiac arrest recovery phase today? Good teamwork ensures every tiny medical detail is checked, which prevents new dangerous problems entirely. When nurses and doctors talk clearly to each other, the patient gets flawless medical care. Please remember to check the description box below to get the full course and learn much more. Section 5. Welcome back to our class, where we are learning how to save lives together today. In this fifth section, we will talk about very special medical emergency situations right now. Sometimes the normal rescue rules need to change a little bit to help the patient. We must learn these special changes, so we can save every single person we meet. Let us start with pregnant women, who need extra special care when their heart stops. A pregnant mother has a baby inside, which pushes heavy weight on her blood pipes. When she's on her back, the heavy baby stops the blood from moving well. You must gently pull her big belly toward her left side to free the pipes. Moving the belly to the left side allows the fresh blood to reach her heart. You still do your normal chest pushes, but you might push a little bit higher. If the shock machine says to shock, you must shock her exactly like normal today. If she does not wake up fast, the doctors might need to deliver the baby. Delivering the baby quickly helps both the sick mother and the little baby survive today. Now let us talk about a patient who has taken too many dangerous bad drugs. Opioid drugs are very strong painkillers, which can make a person stop breathing completely today. If they are not breathing normally, you must give them a drug called naloxone fast. You must try to warm up their body while you do your steady chest compressions. Take off their wet clothes quickly and cover them with very thick and warm blankets. The doctors can use a special warm fluids to heat up the blood in the hospital. Once their body is warm again, the normal drugs and shocks will work much better. These special situations are tricky, but your basic rescue rules will always guide you well. Good chest compressions and fast shocks remain the best way to fix a stopped heart. Now we will review this information with some more practice questions for your big test. Train, test, we need to fix, repeat, until you are ready to pass with ease. 1. What must you do differently when a heavily pregnant woman has a stopped heart today? You must gently pull her pregnant belly to the left side during your chest compressions. Moving the baby removes heavy pressure off her main blood pipes, helping the blood flow. Two. Why is it bad for a pregnant woman to lay flat on her back today? The baby crushes the large blood vein, stopping blood from returning to her sick heart. If blood cannot return to her heart, your chest compressions will not pump any blood. 3. Where should you place your hands for chest compressions on a pregnant mother right now? You should place your hands on the breastbone, but slightly higher than a normal person. The growing baby pushes the inside organs up, so the heart sits a bit higher. 4. Can you use the electrical shock machine on a pregnant woman during a medical emergency? Yes, you must use the shock machine exactly the same way to save her life. The electrical shock safely travels through her sick heart, and it rarely hurts the baby. 5. What happens if the pregnant mother does not wake up after a few rescue minutes? The doctors must perform a fast surgery to deliver the baby out of her belly. Delivering the baby quickly is the best way to save both the mother and child. 6. What dangerous drug type is causing many people to stop breathing in their homes today? Opioid drugs are very strong medical painkillers that completely stop the human brain from breathing. People take too much of this drug, and their lungs simply forget to take air. 7. What special rescue drug can reverse the bad effects of an opioid drug overdose today? Naloxone is an amazing reversal drug that quickly wakes up the brain to start breathing. This drug knocks the bad opioids away, allowing the brain cells to function normally again. 8. How can you easily give the naloxone drug to an unconscious opioid overdose patient today? You can quickly spray the liquid drug straight into the sick patient's soft nose area. The nose has many tiny blood vessels, which absorb the helpful drug into the body. 9. What should you do for an overdose patient before the naloxone spray starts to work? You must provide strong rescue breaths to keep their brain alive until they wake up. Naloxone takes a few minutes to work, so your breaths are keeping them totally safe. 10. What is the very first thing you must do for a drowning patient right now? You must carefully pull them out of the water and onto a hard, flat surface. You cannot do good chest compressions if they are still floating in the deep water. 11. What is the most important rescue step when treating a completely unconscious drowning victim today? You must give them rescue breaths immediately to replace the air they lost underwater today. Their lungs are starved for fresh oxygen, so giving air is your top medical priority. 12. Why should you never push on the stomach to remove water from a drowning victim? Pushing the stomach forces them to vomit, which puts dirty acid into their clean lungs. Only a small amount of water enters the lungs, and stomach pushing causes terrible harm. 13. What is it called when a patient has a dangerously low body temperature right now? A dangerously low body temperature condition is called severe hypothermia in the medical field today. Cold weather or cold water makes the heart freeze, stopping normal electrical beating signals completely. 14. Why is a freezing cold heart harder to restart than a normal warm human heart? The frozen heart muscle is very stiff, and it does not react well to drugs. You must warm the body up slowly before the rescue drugs can work perfectly well. 15. How many times should you shock a freezing cold heart if it is shaking wildly? You should shock them once, and then focus on warming their cold body up safely. Extra shocks will not help a frozen heart, so you must fix the cold problem. 16. What should you quickly remove from a hypothermia patient to help them get warm again? You must completely remove all their wet clothes to stop them from losing more heat. Wet clothes hold the freezing cold against their skin, preventing them from getting warm safely. 17. How do hospital doctors safely warm up the inside of a freezing cold patient today? Doctors push specially warm salt water fluids straight into the patient's knee or arm blood vein. Warm fluids travel inside the blood pipes, heating the sick frozen heart from the inside. 18. Should you delay doing your hard chest compressions if the patient is freezing cold today? No, you must never delay your good compressions, even if they are freezing cold outside. Chest compressions are the only way to move blood until the heart is fully warmed. 19. What is the overall rule for treating special emergency situations like pregnancy or drowning today? You fix the special problem fast, but you always keep doing high-quality chest compressions. Excellent basic life support skills remain the main foundation for saving every single patient today. Please remember to check the description box below to get the full course and learn much more. Section 6. Welcome back to our final class, where we finish learning about saving lives together today. In this sixth section, we will talk about hard choices and ending our medical care. Sometimes a sick patient does not want CPR, and we must respect their personal wishes. They might have a special medical paper, which tells us not to push their chest. This special paper is called a Do Not Resuscitate Order, or a DNR for short. If you see a valid DNR paper, you must not start your hard chest compressions. You must step back and let them rest, which is a very hard thing to do. We must respect what the patient wants, even if it makes us feel very sad. You have worked so hard in this class, and I am very proud of your effort. You now know the exact steps to take when a terrible medical emergency happens suddenly. You know how to push on the chest, and how to use the shock machine perfectly. You also know how to give rescue breaths, and how to work as a great team. Now we will do our final practice questions, to make sure you are totally ready today. Take a very deep breath right now, and let us finish this amazing journey together. Train, test, we need to fix, repeat, until you feel perfectly ready for the exam. 1. What does a DNR order mean for a patient in sudden cardiac arrest today? It means you must not perform chest compressions or use the shock machine on them. The patient signed a legal paper before getting sick, saying they want a natural death. 2. What should you do right away if a family member shows you a valid DNR? You must immediately stop your rescue efforts and respect the patient's personal medical wishes today. Ignoring a valid DNR paper is against the law, and it hurts the patient's rights. 3. Who has the final authority to stop the rescue attempt when a patient will not wake? The designated medical team leader is the only person who can stop the rescue attempt. The leader looks at all the medical facts before making this very sad final choice. 4. What does the leader think about before they decide to stop pushing the patient's chest? They think about how long the heart stopped, and if any drugs actually helped today. If the heart shows absolutely no signs of waking up, continuing will not help them. 5. What is the very first thing you do after the team stops the medical rescue? You stop pushing the chest, and you turn off the noisy medical monitors right away. Turning off the loud machines makes the room quiet, which is better for the family. 6. How should the doctor act when they tell the family that the patient has died? The doctor must speak very clearly and kindly, without using any confusing big medical words. The family is in deep shock, so they need simple words and a lot of care. 7. Is it normal for the medical rescue team to feel sad after a patient dies? Yes, feeling very sad is completely normal, because we truly care about helping sick people. We put all our energy into saving him, so losing a life hurts our hearts. 8. What is the best way for the team to process their sad feelings after a loss? The team should sit down together in private and talk about exactly how they feel. Sharing your heavy emotions with friends helps you heal and prepare for the next patient. 9. Why must you look at the medicine bottle twice during a crazy medical emergency today? You must check it twice to ensure you have the exact right drug and dose. Many drug bottles look exactly the same, and giving the wrong one is totally deadly. 10. What specific detail on the medicine bottle must you always check before pulling the liquid? You must always check the expiration date to make sure the medicine is still good. Old medicine loses its strong power, and it will not help restart the sick heart. 11. What must you do out loud right before you push a drug into the blood vein? You must announce the drug name and dose loud, so the team leader hears you. This gives the team one last chance to catch a mistake before it is too late. 12. What can easily happen if you accidentally push the wrong drug into the sick patient? The wrong drug can completely destroy their sick heart and cause them to die instantly. We must use our safety rules every single time to completely prevent these terrible accidents. 13. What is the best way to catch a drug mistake before it hurts the patient? Good closed-loop communication is the very best way to catch a silly human mistake. Repeating the order back to the leader makes sure both brains agree on the plan. 14. If the leader tells you to give a huge drug dose, what must you quickly do? You must respectfully question the very large dose and ask them to check the math. Speaking up is your job, and it protects the patient from a bad medical error. 15. Why is silence so dangerous when a team is trying to save a life today? Silence is bad because mistakes go unnoticed, and the patient suffers the horrible consequences today. A loud and talking team is a safe team, because everyone is sharing their thoughts. 16. Let us review quickly. How deep do you push on an adult patient's chest today? You must push down at least 2 inches to squeeze the blood out of heart. Good depth ensures the blood reaches the brain, keeping the cells alive during the emergency. 17. What is the correct speed for your chest pushes during a normal adult rescue attempt? You must push between 100 and 120 times every single minute today. This steady rhythm creates a good blood pressure, mimicking a real beating human heart safely. 18. What is the perfect ratio of pushes to breaths for a patient without a tube? You give 30 hard chest pushes, and then you quickly give them 2 soft breaths. This specific ratio gives them enough oxygen, while keeping the blood moving constantly around body. 19. What is the biggest secret to passing your big test and saving a real life? The absolute biggest secret is practicing your steps and working perfectly together as a team. Medical emergencies are completely chaotic, but good team practice brings calm and saves many lives. Please remember to check the description box below to get the full course and learn much more.